So now we've snipped that little band under the tongue, right there. And you're going to have a little open raw area. The mouth as it heals is always very ugly. It's going to be a little white, yellow, gray, brown. It's always going to look like a little bomb went off under there. That's completely normal. That's the way the mouth heals. Don't worry about it. Now, as it's healing, we want to keep the tongue moving around so it doesn't completely reattach. So one way to think about it, if we snip it here, the tongue's moving around a lot, it's always going to reattach a little bit here, but if we don't move the tongue at all and we keep it like this the whole time, it will completely reattach. So we do want to make sure the tongue keeps moving. In older kids or adults, it's simply doing a little wiggly, stretchy exercises. In kids, you can make it into a game. Adults, it's pretty straightforward. Generally 4 or 5 times a day. Just kind of lift, maybe stick out. Now sticking out, it may hit your teeth a little bit and be uncomfortable, but really we're working on range of motion. Once that's completely relined with pink skin again, you can stop that. For newborns and tiny kids who aren't going to follow instructions, the easiest thing to do is for somebody to reach a finger in there and either lift up or swipe side to side. That's going to simulate that little lift or separation. Again, we're shooting for 4 or 5 times a day. In newborns, it might be easier to do those little stretching exercises with every feed as opposed to 4 or 5 times a day. You're usually stressed out enough about keeping track of feeding schedules, sleep schedules, when was the last pee, when was the last poo, when was the last diaper change. It might be easier just to do it before every feed, but what you're going to shoot for is at least 4 or 5 times a day. In small children under 6 months old, you almost never need any medication. The older you get, the more likely you are to need a little Tylenol or Motrin. You never need anything stronger than that. For older kids and adults, you generally want to avoid salty, peppery, spicy, acidic things that may irritate the area and burn. If you do a shot at tequila, for example, it's not going to be fun. Ultimately, whatever you put in the mouth, it may be uncomfortable, but the mouth will still heal okay. In newborns, there's nothing remotely irritating about breast milk or formula, so I wouldn't worry about it. For newborns, snipping that little band instantly allows the baby to move the tongue better, but it doesn't change any other variables like muscle tone, motor control, breast anatomy, milk supply. So if you're still struggling afterwards, please see a lactation consultant and they can help you with those other issues. For older kids where the reason for doing it is for speech, you likely will still need to work with your speech therapist even after the tongue is able to move better, because the kid has a few years of kind of unlearning and retraining to do for that tongue. Other than the stretching exercises, there really isn't anything to look out for or do. We don't even schedule a follow-up visit because there aren't anything medically that we have specific concerns about. Obviously, if you have additional concerns, feel free to contact the office.